Let's face the facts. In these times, we're all thinking of the same two things: staying safe and saving more. Here at Digi, we understand what you're going through, and we also understand that this is no time for tricks and gimmicks from the other guys. Did you know that the other guys' truly unlimited data offer is not 100% LTE speeds at all times?
Hey, I think you're breaking up.
What? You're breaking up with me?
Whereas Digi customers enjoy 100% true LTE speeds in all Digi plans.
Nah, babe. I keep it Digi 100.
Unlike the other guys, Digi doesn't throttle customers down to 3G.
Which is why anyone would be a fool not to invest. So, do we have a deal? Hello? Hello?
Instead, Digi offers more LTE speeds in all mobile phone plans.
You, sir, are brilliant. Thank you for doing business with us.
Plus, the most affordable prepaid mobile data plans starting as low as $1. So if you're looking for more value at a cheaper rate, then join the Digi family. Because with Digi, you enjoy a better mobile experience. But don't just take my word for it. Switch and see for yourself. Do you need COVID testing for travelers? Convenient and secure bookings for rapid antigen testing now available through Belizeing.com. Results are provided in 30 minutes with electronic and printed results compliant with CDC requirements to return to the United States.
Hi, good afternoon, everyone. Thank you for joining us this afternoon for this month's webinar session brought to you by the Belize Hotel Association in collaboration with Belizeing.com. My name is Angela, and I'll be your host along with Simone from the Belize Hotel Association. Today, our guest speaker is Mr. Emir Castaneda, the Health Director from the Central Health Region, as well as our panelists to answer your questions. Our panelists includes Ms. Melinda Guerra, Regional Manager, and Dr. Aleda Pot from Ministry of Health and Wellness. And today, our presenters and panelists will be discussing the COVID-19 vaccination for frontline workers. But before we get started, I'd like to touch on some housekeeping rules. If you have any questions throughout the presentation, please feel free to enter them in the chat on your right-hand corner, or if you're on mobile, then you can enter them on the bottom of the screen. They will be answered at the end of the presentation. There will also be a couple polls that will be posted during the session. I'd like to ask for your participation on the polls. And also, if you experience any lag in the audio or the video, you can click on the red reconnect button at the top to troubleshoot any connection issues. Without further ado, I'd like to pass on to
Thank you, everybody, for joining us for another wonderful session and a very informative session here today. We have been asked by the Ministry of Health to reach out to all of the frontline workers so that they would be able to be educated about the COVID-19 vaccine that Belize now has in country. There has been a lot of talk, lots of talk about it, and I know you have a lot of questions about how it will affect you and the procedures and the type of vaccine that's going to be here. And who better than the Ministry of Health to actually educate you in this process. So without further ado, I'd like to introduce Mr. Emir Castaneda. He's the Health Education Officer from the Ministry of Education. And we will also be joined by Ms. Melinda Guerra, the Regional Manager, Dr. Aleda Pot, and Nurse Donaldine Lizama, who will be also here to answer your questions in the question and answer period. So Mr. Castaneda, the floor is yours.
Yes, good afternoon, everyone. My name is, as per the introduction, I'm Emir Castaneda. I'm the health educator here at Central Health Region, Belize City. We are under the Ministry of Health and Wellness. And I've been asked to do this presentation while our team of professionals arrive from their activities they had in the islands. So they should be here by now. So, but I will start by giving you the introductory part. Okay, so I will go to my first slide. Um, this presentation has to do with the what is about COVID-19 in Belize. We will speak about the vaccine, the different types of vaccines, how vaccines protect us, the availability of the vaccines in country, and then important here is the phases of rolling out the vaccines. We're also going to have some discussions in regards to safety and also addressing some myths that we have been hearing, and we know that is happening. People are sharing here in Belize. Yes. So basic introduction here is it has to do with a virus, this SARS-CoV-2 virus, which has caused the pandemic and has affected the country of Belize. As we all know, the symptoms are the cough, shortness of breath, fever, chills, muscle pains, or throat. And then when we learn about the loss of taste or smell, we know that more than likely it is COVID-19. And then what we have to do is have to go and take our tests. Recent studies indicate that the virus can spread by people who are not showing symptoms as well. So there are many out there who don't show symptoms and could be spreading the virus. And what we do is we just assume sometimes we take it for granted they're healthy, and when later on we learn they were not. They were infected by the COVID-19 virus. There's also studies that persons can get COVID-19 by touching frequently touched surface areas or objects. So by touching, and then if you touch your mouth, nose, and your eyes, then there is a probability you can get infected that way as well. There are still many unanswered questions about the transmission, and research is still ongoing to answer these questions. But importantly here is that older adults, the elderly, people of any age who may have serious underlying medical conditions, those who are diabetic, those who are hypertensive, those who suffer from cancer, they are at high risk for more serious complications. And that is what we don't want, for them to get those complications and they end up at the ICU in the hospital. This diagram basically is showing us the COVID-19, the virus, how it affects our lungs. And when it enters through our mouth, nose, or eyes, then it ends up in our lungs. And when it enters in the lungs, it ends up in this particular sacs that air sacs that we call the alveoli. And if you look at the top little sacs, it's a healthy one. And when you look at the bottom one, it has been totally infected by the virus. And when it looks like glue, it's thick, so it causes difficulty in breathing. So this was when we were learning about the COVID-19. However, as we go along with more research, we learned that COVID-19 not only affected the lungs, but affected many of our organs, our liver, our heart, our brain, placenta, kidneys. So we see that COVID-19 do affect other organs in our system, and that's eventually it leads to death. A little different from the seasonal flu, which we it just affects the lungs. Services in Belize in regards to the COVID-19, what we have been doing, as you all know, and as in fact as the whole community in Belize knows, patients that present symptoms with fever, cough, shortness of breath, fatigue, general malaise, they know what to do. They have to go to our flu clinics to get an assessment. So what happens is they go through a triage. They check them by the nurse. They check their vitals, and then the medical doctor makes an assessment. That is where when they decide if a PCR test will be done or a rapid test will be done. If the result is positive, we all know that the person is given the flu packages and are advised to return at home for 14 days. So they have to isolate for 14 days once you're positive. Contact tracing is done for that person so that other close contacts can be assessed and swabbed as well. But most persons with COVID-19 experience mild to moderate symptoms and do not need to go to the hospital. Instead, they end up at home by home care instead. Complications or complicated or unstable patients who need emergency care will be referred to the regional hospitals or to Carthusia Memorial Hospital. This diagram shows us of the different vaccines we have had in country, and these vaccines has to do with all the vaccines we have had in the past, with VCG, polio vaccines, Penta, the MMR, from 2017 to 2020, and it shows that Belize has had good coverage throughout these years. So vaccines is nothing new. We have had vaccines from, as far as I can remember, we have had vaccines. We have some dates here of cases, of our last cases that we had in the country. For example, in 1981, that was the last case of polio in Belize. 1991 was the last case of measles. 96, congenital rubella syndrome. In 97, we had the last case of neonatal tetanus, and in 2000 was our last case of rubella. So by having these vaccines in these years, it shows us that we have ended with these diseases in the country. Now, with the COVID-19 vaccine, this vaccine is no way different from other vaccines. The COVID-19 vaccine teaches your body to develop antibodies to fight off the virus that causes the COVID-19. So what we get is like a shield. It's like an antibody that will help us fight the virus if we will get exposed to COVID-19. Now the body is left with a supply of memory, and these are cells. We call them the T cells or the B lymphocyte cells. And this when we are left with this memory, once we are vaccinated, these cells will remember how to fight the virus if we ever get exposed in the future. Now, myths have arisen because of what we have been referring to memory cells, and people have translated it into probably computer memory, and that's why they're saying they're injecting you with chips, with computer chips, and it's not so. Okay, so we are just calling it in quotes memory, because they will help us fight when we get exposed in the future. I must say that the COVID-19 vaccine is safe and effective. In fact, I got my vaccine on Tuesday, and I'm right here. The COVID-19 vaccine protects against severe illnesses, hospitalizations, and deaths due to COVID-19. So this is very important here, ladies and gentlemen. It will protect us getting it severe. It will protect us. It will help us from not reaching the hospitals. It will help us saving lives. The different types of COVID-19 vaccines. This is more a technical approach to the types of the vaccines. But I must say that this is basically what we're using are mild inactivated versions. So it's not the COVID-19 that we're injecting into you. So we are using a whole virus system, but it's not the COVID-19, and that virus will teach our body to fight the COVID-19. And this is generally what we do in many other vaccines. And one of the vector vaccines that we have in country is the AstraZeneca, and that's the vector type vaccine. We have other types of vaccines, the protein submit vaccines, which just includes harmless species, proteins of the virus that causes COVID-19, but it's not the COVID-19 virus. We have the mRNA vaccines that contains smaller materials from the virus that causes COVID-19, but it's not the COVID-19 virus. We are just using the materials from it so that our body recognizes it and can fight against the COVID-19 virus if we get exposed. So we have here the Pfizer, which is a RNA, which uses a virus genetic code. We have the Moderna vaccine, and this Moderna vaccine is being also produced in the US. But this, for example, the Pfizer, the thing with Pfizer is that it requires very low temperatures for storage. So it's something that it will cost us more to have these vaccines in the country. We also have the Sputnik vaccine, which is a Russian vaccine, and that is still in phase for trials. And then we have the AstraZeneca one, which has been the ones that has reached the country. And all of these vaccines require 2 doses. So the AstraZeneca is the one that has been in country and is being used widely in Europe, has been used in the Caribbean as well. So that is the one that we're using in Belize. Vaccines have to go through a standard criteria. There is no vaccines that we would call it generic vaccines or vaccines that will be produced in the black market. All vaccines have to go through a series of recommendations, approvals, particularly from the World Health Organization and from very important countries like Australia, the European Union, Canada, Switzerland, and of course the FDA in the USA. So once all these entities approve of the vaccine, once they go through different phases, then the vaccine is recommended globally by WHO, and AstraZeneca is one of them. In country, again, it's not like we are just introducing the vaccine in country and we're starting to use it. We have to go through a series of approvals as well. So in country, we have a multi-sector mechanism, a committee consisting not only of the government but different sectors from the Mayors Association, Pharmacists Association, Cancer Society, National Council of Aging, and we also have the National Technical Working Groups. We have the National Immunization Technical Advisory Group. So all these entities are overseeing whichever and whenever a vaccine enters the country. So we are not working alone. And importantly here is the National Immunization Technical Advisory Group, which is an independent committee consisting of important people here who have wide experience with immunizations. So we have, for example, our chair, Ms. Lydia Turton. We have Dr. Marcelo Coy in this immunization technical working group, followed by other people here, and then we have like Ms. Beryl Irons, who is from the Caribbean, and so you will know most of these doctors who are constantly reviewing evidence on the COVID-19 and make recommendations to the Ministry of Health in regards to COVID-19 and the vaccines. So we are not alone. So how vaccines protect individuals and communities? When persons get vaccinated, their risk of infection is reduced. They are also less likely to transmit the virus to others. So as more people in the community get vaccinated, fewer people remain vulnerable, less likely for an infected person to pass the pathogen. So when this happens, we develop something that we call herd immunity. So it becomes like an indirect protection from an infectious disease. And that happens when community develops in a population either through vaccination or through previous infections. So that is what is our aim, herd immunity. It exists when individuals who are not immune but live in a community with a high proportion of immunity have a reduced risk of the disease as compared to non-immune individuals living in a community with a small proportion of immunity. So this is what we were experiencing like last year. Availability of the COVID-19 vaccines. You have heard that we have received the first tranche was 1,000 vaccines a couple of days ago, and we're receiving more very soon. So the vaccinations are in our plan, in the country's plan, is that vaccination would tentatively be scheduled for the ending of March, April 24th, but it seems that it will be even earlier. Okay. So the as per our plan, the initial supply of COVID-19, like when we got these 1,000 vaccines, these vaccines will immediately be given to phase 1 and phase 2 groups. And right now, I will list to you the different phases of the vaccines. So at this time, I will take a pause here, and I will ask Ms. Our primary health coordinator, Ms. Desiree Mejia, to continue with our presentation. Excuse me.
Hi, good afternoon. So like Emery was mentioning that the rollout would be a phase approach, and there are 5 phases for the rollout. And we're in phase 1 right now because we received 1,000 vaccines from Barbados, and we are awaiting the arrival of 25,000 vaccines tomorrow. So phase 1 covers the healthcare workers, both public and private, the elderly population, 60 and older, persons with diverse abilities. So we're looking at with persons who might have any mental issues, or persons who may have cancer or HIV. These are the persons we're considering under diverse abilities, and persons from the National Assembly. Phase 2. So as soon as we have covered our quota for phase 1, we move directly into phase 2, which will be the police officers. And the phase 2 was determined based on risk. So if you work in an environment where you have, if you work in an environment that you're exposed, you come in, you're exposed to a lot of persons. These were persons who were considered in phase 2. So in phase 2, we have the police officers, we have custom officers at the port of entries, immigration officers, the tourism sector, teachers, transportation officers, and prison guards. Phase 3, we're looking at the BDF, the Coast Guard, firemen, and the utility workers. And under these utility workers, we're looking at the utility companies, detail, BWS, BL. And phase 4, we're considering all other public officers. And then the last phase will be those, the population that falls directly between the age group of 18 to 39 who did not fit previously in one of the 4 phases. So this slide kind of elaborates on what high-risk conditions that are considered. We have diabetes, high blood pressure. So persons who have more than one comorbidity, these are persons of interest to be those who are considered to get the first dose in phase 1. So in order to stop the pandemic, it is required, I believe my colleague talked about the herd immunity. So the vaccine works with your immune system, and your body will be ready to fight an exposure because your system builds up your antibodies. So when that virus is introduced, the immune system already has the components to fight that virus. And this is a very important slide because most persons at this point believe that once they get vaccinated, there will be instant immunity. But because, like I said, it's a relatively new virus. We're, I think, 1 year post-COVID, and research is still occurring. And therefore, after vaccination, it is required that we still use the mask because, like I said, there is not enough research to determine whether or not there will be transmission after you get vaccinated. And with time, we will know the answers to these questions. The vaccine will be given in 2 doses. The first dose and this follow-up dose will be 8 weeks after. And for a person to be considered fully immunized, they will have to have 14 days after the second dose to be considered fully immunized. No, this is what, like, one of the common questions when we do the health education sessions. People want to know what will be the side effects. But as mentioned before, the concept of vaccination isn't new, just that within our society, we're more familiar with it being with the childhood diseases. But just like those vaccinations that are given in childhood, this vaccination will have side effects. And some of the common side effects will be fever. And of course, they may be soreness to the site that the injection is given. There can be chills, and these were reported as the most common symptoms after persons took the COVID-19 vaccine. Presently in the central region, we vaccinated almost 300 workers. And so far, out of that 300, we only had one person who developed a fever like 24 hours after. That was just that one case. And most persons reported that the site that the vaccine was given was sore. So those are the two common symptoms that we're seeing within our setting in Belize that persons are exhibiting after they receive their first dose of the COVID-19 vaccine. Here it just summarizes. It tells you that the side effects are usually minor and temporary, such as the sore arms and a mild fever. More serious effects are possible, but extremely rare. And just to draw inference again, that we did 300 within the Belize district for healthcare workers. And we, like I said, one person with fever, and of course, nobody hospitalized, and most persons reported that they had a sore arm after the vaccination was given. This one just tells you what is the makeup of the AstraZeneca, because that's a question that most persons ask because they want to determine if they're allergic to any component in the vaccine. And here you see a list of what is in the vaccine. We have the L-histamines, the ethanol, sucrose, sodium chloride, and water for injection. So like I said, the components in this vaccine is no different from other vaccines because the concept isn't new. So here, the next few slides will talk about some of the myths. And here it says, there is still much we need to know, because I mentioned before that we're just like 1 year post-COVID. The immunity someone builds after having COVID-19 can vary from person to person, and there isn't enough data right now to know how strong this natural immunity is. So right now, the research is showing that after you receive your 2 doses, you might need a booster shot every year for the COVID-19 virus. As we progress and there is more research available, some of these questions that we have pertaining the vaccine will be answered. Since COVID-19 can have severe health risks and there is the possibility of reinfection, the general recommendation is to get the vaccine when it's available upon consultation with your healthcare provider. And hence we're doing the sensitization session to get an idea of how many persons are actually ready to receive the vaccines and to actually give the facts, because most times persons are they do their research, but they don't research from credible sources, and then they form their opinions based on what is read from the internet. But in these sessions, we provide facts from reputable known sources. Another myth is that the vaccine has a microchip in it. Vaccines are solely used to protect people from diseases that can make them sick and cause death. Microchips have never been used in any vaccines and are not a part of the COVID-19 vaccines. And these myths were generated based on questions that we were receiving from the general public when we started our health education sessions. Another myth was that the vaccines and the human cells, so people were saying that they had aborted tissues in them. No vaccine, including COVID-19 vaccines, have been developed, tested, or contain tissues from aborted human fetuses. Another myth is that vaccines causes infertility. Studies shows that vaccines that have already received emergency use authorization. I believe Emmer spoke about all the organizations that have to approve these vaccines. So these vaccines are approved and they do not have any effect on fertility. In fact, some participants in the clinical studies got pregnant during the study. No vaccine suspect of impacting a person's ability to conceive have ever been or will be approved. And that's the last slide.
Thank you so much, Ms. Des. How are you today?
I'm good.
I have a couple of questions coming out of the presentation, and I'm just going to take the opportunity to remind everybody that's listening that they can enter their questions in the chat, and then we'll be able to answer anything that you need addressed while we have the Ministry of Health here with us. So I have a question for you, and this is just throwing it out there. A lot of people have expressed their concerns over the selection of the vaccine that is being used here in Belize. And I know when Mr. Castaneda was presenting, he mentioned that we do have a panel that evaluates prior to us accepting. For those of us who were not attending or at the beginning when he mentioned that, could you just go over that process of the selection and how is it that Belize arrived at using AstraZeneca for the vaccine of choice?
Okay. So I think most persons are familiar with the Pfizer. So that kind of determined that most persons wanted Belize to receive the Pfizer. But the thing with the Pfizer is the management of the cold chain. It should be kept with, I think, minus 20 degrees Celsius. So it would mean that if the government decided to bring in Pfizer, it would have been at a cost to the government, because then we would have to upgrade all our cold chain facilities, because most of the vaccines that Belize receive, and we're talking about the childhood vaccines, those ones are kept between 2 degrees and 8 degrees Celsius. And so is this AstraZeneca. It can be maintained within our existing cold chain, and hence the reason why the country selected Astra based on the cold chain management.
Okay, all right, thank you. Another question is the efficacy of the AstraZeneca vaccine. So a lot of people have questions about how effective is this vaccine, and then you're saying that we have preliminary trials. And I think one of the big clouds that hang over everybody's head at this moment is that, you know, the proper procedures for establishing a vaccine is that they would have undergone years of testing so that we could have conclusive evidence. And what is being asked of the nation at this time is to take a vaccine that has been approved for testing, but for use, for human use, but has actually not gone through what has been the established norm. So I'm going to put a question in there and ask you, is it that the medical industry has evolved so much that the process is now shortened and we are able to get a vaccine without going through the prolonged process of clinical trials?
I think in the beginning of the presentations, we've mentioned that the concept behind vaccine isn't new, you know, and with this vaccine, with this particular vaccine for COVID-19, it wasn't first designated as COVID-19. They were looking at it, and the process started years ago where they were looking at infectious diseases. And the technology that they use in this particular vaccine is one that is used in other vaccines, you know. So it's not that it was developed quickly, you know. It's just that because they had been researching before, it made it easier to create the vaccine to respond to COVID when it was introduced late last year.
Okay, excellent response, because that actually helped me personally to decide, because
Yes, and that's the point that we want to drive, is that the concept of vaccines isn't new. The technology isn't new. When you get I think most persons, if you have a young child, you'll be familiar that they receive the first vaccine at birth or within the first 7 days of birth, the BCG. And in the BCG is a weakened form of the virus that is injected into the child to create an immune response. So like I said, the technology isn't new, and research has been occurring prior to COVID, but it was more geared to infectious diseases.
Okay, excellent. All right. From the floor, we have a lot of questions being asked about how is it that the properties will actually enroll in this vaccination program? How will they be contacted?
Well, right now we're still kind of like reviewing the process with our phase 1, and since that's the phase that we're presently in, we have a database. So most of those persons will be contacted for interviews to come in and do their vaccines. I guess eventually in rollout, we'll be asking persons to call in. We'll give numbers for them to call in and make appointments. That's by the time. And then if you notice, each phase, the groups get bigger and bigger in terms of numbers. And so I think as it rolls out, the approach will change, and we might ask persons to actually call our hotline and make an appointment to receive the vaccines.
Okay. I have a question here regarding the estimated date for the phase 2 rollout. So you mentioned, or I think Emir mentioned earlier, that tomorrow we are expecting another shipment of 25,000 vaccines. Okay. At the end of the whole period, what percentage of the population do you expect to be vaccinated?
We're looking at 30%. So that's like 120,000, I believe. Don't quote me because I don't have my my book near.
You won't quote it.
It's 30%.
Okay. And is 30% enough to encourage or build herd immunity? Is that effective?
No. But remember, this will be ongoing. So being that it's new and it's introduced, immediately we're hoping to cover 30%, but as time progresses, then we'll capture the remaining portions of the population that wasn't vaccinated. In terms of herd immunity is achieved between 75 and 80% of the population. But whether or not we achieve herd immunity will be dependent on the population, because the vaccine isn't mandatory. And persons have a right to choose whether or not they want to be vaccinated. And I think that will determine whether or not we achieve the herd immunity that we want to achieve.
Okay. Angela, I'm just going to ask you right now, are you able to show the poll? Because we did ask the panel here who would be interested in taking the vaccine. I'm not sure if everybody got a chance to respond, but I believe that the numbers are actually impressive. I think it was about 64% of the respondents that actually.
Before I cut off the poll,
how do I view it?
It was I have it here in front of me. So there is 70% of the attendees in the live room that said that yes, they will be getting the COVID-19 vaccine, which is very.
Well, that's good news for the Ministry of Health.
Yes, and there's only 3% that said no, and 25% that said that they're uncertain and they needed some information.
And it's no different because, like I said, we're not the first country to administer the COVID vaccine. The United States and certain part of Europe, they started from last year. And whatever you reported is in line with what their researchers showing. There will be a small percentage that will say no. I think they had it at 3% of the population will say no, we don't want it, forget about it, and then you'll have that portion that will say, and I think that accounted for probably 15% or 18% that will say, I needed more information, I need to think about it, and I'm not ready at this point. And then most of the persons who are surveyed, they are ready to accept the vaccine. And I think that has a lot to do with because most people associate COVID with death. And I think that is what is driving the uptake and persons' willingness to accept the vaccine.
Yes.
Okay.
And I think I guess a thought in a lot of people's mind is death. What if I get the vaccine and that causes death? Because obviously we see some news reports from let's say the US that this person died after getting the second dose of the COVID-19.
But
how can you reassure those people, or how can you reassure the Belizean population that that's more maybe related to underlying health issues, or that won't be the case with this vaccine that will, or the Ministry of Health and Wellness will be administering to the population?
In terms of death, like I said, when we read, we need to take from credible sources. And in terms of death, none of those deaths were linked to having the COVID-19 vaccine. Matter of fact, 6 million persons already took the vaccine worldwide. 3 million persons already took the vaccine worldwide. If one of the outcome was death, I would believe that the media would have been flooded with more of those stories if one of the outcome was death after receiving the COVID-19 vaccine.
Okay. All right. Des, we have another question from the floor. If I'm a blood donor, how will the vaccine affect me being able to contribute donations?
I don't see it having, it wouldn't have any kind of outcome on whether or not you're a blood donor.
Okay, so I can take the vaccine and continue to be a blood donor.
Yes.
Okay, excellent. And then there's another question, because you mentioned that phase 1 is currently in process, and if I have a person who is in my family and is elderly and I wish to get the vaccine for them and they qualify for over 60, what is the process for getting that person vaccinated?
Like I said, we have, for right now, we are working from a list. And our list for persons, just for the Belize district, because I do not speak for the entire Ministry of Health, I only speak for the Belize district. And our list right now that was populated from several databases, because like I said, information is free for flowing. And our database right now has Belize district with 18,000 plus persons, 60 and over. So for right now, because remember the first shipment will only be 25,000, I think 25,000 doses. So obviously, and we're talking 25,000 for the entire country. Right now we're working from our list, but like I said, as time progresses, we'll need to revise, and more than likely, persons who want the vaccine or are ready to take the vaccine will be encouraged to call the hotline to make an appointment.
Okay. Does that hotline number already exist? Is this something that we can?
Yes, it already exists. So the hotline number, just give me 1 second.
Okay. All right.
I think probably we can share it. I guess at the end we can send it to you, and then you can share it within your.
Or what we could do, we could just type it right here in the chat group so that persons can have access to the number.
Okay, sure.
All right. Another thing is, especially for the hospitality sector, how does a person qualify? What proof will they need to be able to show in order to get the vaccine in phase 2?
In phase 2. So what we're asking is that persons, when they visit the sites. Well, if you can, we encourage persons to get registered on the Belize Health Information System. I guess that's the reason we've sent out the spreadsheet, and it captures all the information for us to register a person if they do not exist already in our database. And let's say for whatever reason you're not captured and you're interested in receiving the vaccine, the registration is not a deterrent. You still can show up at a site when it's announced, as long as you take your social security card so that you can be registered there and then. Just that we're encouraging persons to register before, because then that will create a delay in doing it on the site, especially if we're thinking about vaccinating 300 persons for the day. So we just encourage you to register before, and if not, like I said, it won't be a deterrent. You can bring your ID on that day and be registered at the site.
Okay, so that was the Belize Health Information System. Do you have the information for us to access that so that the hoteliers can register their staff?
No, that would have to be from our side. So like I said, when you guys send the list, we review it, and then we actually verify whether or not the persons are registered on BHIS. And then, like I said, based on the spreadsheet, all the information is there for us to create ID for that person. And when they show up, then they'll be already incorporated into the system.
All right. I think I may have missed something that you explained. So the Belize Health Information System is a spreadsheet that has been created by the... Okay. I think that's what I need some clarity on. What is the Belize Health Information System? How does somebody... I'm sorry for asking questions, but you put it out there. How does somebody get onto that system? Because I think that's the questions in the hoteliers' minds right now.
Okay.
How do we now become a part of that program?
That's why, like I said, what is important at this point is for you to fill out the sheets that were issued to you guys. When that's completed, then it's sent back to us, and we can verify if persons already exist in the system. If they don't exist, then we'll create the profile for that person using the same information from the log sheets.
Okay.
And where will people get these sheets that they can fill out?
And just nurses just reminded me that I should mention that once you have access care at any public facility countrywide, you'll be on that system.
Okay. All right. And these log sheets were sent to how do you get a log sheet?
Okay, so we'll get your email, and since I guess you'll have contact with everybody in the system, and then we'll send it to you, and then you can send it out to those other your other partners.
Okay, so what I'm going to announce here is that the Ministry of Health will be sending the log sheets to BHA, and then you can get in contact with us here. You can call us. Our number is 223-0669, or you can email marketing@belizehotels.org. I will put that information in the group chat for you, and then we will issue the list. And of course, the hotline also has the log sheet as well. So if a property wants to call directly to the Ministry of Health, they can also get that log sheet to register their employees. And then a cross check will be done.
Yes.
To see if they're on the Belize Health Information System. And then those that are in that system will be vaccinated first.
No.
Okay, I'm just asking for clarity. So it's everybody who submits their names that will be vaccinated.
Yes.
Okay.
Just in case anyone is asking, is this sheet available on maybe the Ministry of Health and Wellness's website?
No. Remember, I said that I speak for the Belize district. I don't speak for the entire Ministry of Health. So this was an initiative that was introduced by the Central Health Region, and we've seen it that it helps in determine whether or not persons who are within certain target population are registered, because the information is verified on the system. So I guess those requests, if you're from the Belize district or your facility institution falls within the Belize district, I can also give an email that persons can reach out, and we can send the log sheet to them, and that will be RHM. Help me to email. Please. What's the email? Okay, RHM Central at health.gov.bz.
Okay, I quickly typed this now just to repeat. It's RHM Central at health.gov.bz.
Yes, ma'am.
Okay.
All right. Couple more questions coming in the group because it's a very hot topic and people really need to understand what's about to take place. And we're very grateful to the Central Regional Health Division to facilitate this session for us. The question on some of our contributors' minds today is there an actual cost for the vaccine?
The vaccine is free of cost at this point.
All right. So it will be administered free of cost at this point.
Yes.
All right. Now, for persons who are permanent residents, will they also be included in the vaccine plan?
Once they fall within any of the phases, they will receive the vaccine.
Okay. And then if it is that I don't have access to my social security card, is there another form of identification that I can use to be able to access the vaccine?
Yes, the system allows for social security cards, passports, driver's license, residency cards. I think those are the main form of identity, and voters ID. You know, so if you don't have a social security card, any of the ones that I've mentioned are accepted upon registration.
Okay, so I'm just going to recap that. So that's the social security card, your residency card, a voter's ID, your passport, or a driver's license can be used as proof of identification.
Just that there's a preference. If you have the social or if you have the passport, we would encourage persons to use those versus the driver's license or the other ones that I've mentioned. But all are accepted.
Okay. For the remote islands, is there a rollout program in place with that? Because I know that you mentioned that this is a session that's being conducted for those that are in the Central Health Region. So just for the purpose of this webinar, which areas are covered by the Central Health Region?
So under our management is San Pedro and Kikaka.
And Belize City or?
And Belize City, sorry.
Okay.
Yes, and Belize City.
All right, and yes, Miss Sandra, I do see your question. We will have the.
Sorry, and the jurisdiction for Belize district is from Democracia going on the Western Highway and Rayburn Ridge going to the north.
Okay. Yes, this webinar will be available to all persons who missed it as soon as the session is finished. I know Angela and her team are going to work on uploading the webinar, and you will get a link if you're registered that you'll be able to view it.
Yes, a recording will also be uploaded to the BHA's blog website as well. So you'll be able to view the recording from there.
All right, and then I have another question that says, if you are an owner of a tourism business here in Belize, will you be allowed to take the vaccine locally?
Owner of a tourism industry
Of a business.
Once it falls within the phase.
I'm being informed that once it falls within the phases, they will be covered.
Okay, so an owner can participate in phase 2 as a tourism worker?
Yes.
Okay, so owners of properties who are not Belizean can be vaccinated once they provide proof of ownership and they would also need their passport, right?
Mhm.
Okay.
Okay. Are there any other questions at the moment?
Okay. It was just the Turnip Islands, but are the Turnip Islands covered by Belize District? Because
It is. It is.
okay, so for the persons who are in the Turnip Islands, we would also be able to get this log sheet. The BHA doesn't have it in their possession as yet, but the Central Regional Health Division has promised to get it over to us as soon as this webinar is complete. So we will be able to distribute that for you. I just want to make sure that we've answered everybody's questions here today, because this is a unique opportunity for you to have direct access to the practitioners in the field who are actually executing this campaign and are able to guide you in terms of more accurate information. So I'm just going to put a last call for questions. If we haven't been able to accurately address them, please, if you're still uncertain, I believe it was about 15% of you that were uncertain and needed more information. If you'd like to share what else you need so that they can address it here, we would be more than welcome.
Yes, and I've also published the same poll that we published earlier, just in case you guys change your mind after hearing the information that was given during this presentation. In the poll, I see that 100% of the audience said that they'll be taking the vaccine.
Okay, that's excellent. So that means that we did a very good job here today. So Des and the entire Central Health Region team, thank you so much. It's very good that you guys are actually engaging the public and having these discussions to let people know exactly what it entails. Just a quick synopsis of what we covered. We covered why we've chosen the vaccine. We've covered what type of vaccine it is, that it's one that has a genetic gene that's similar to all the vaccines that are being used right now. The process is not rocket science. It's been tried and tested several times over, and what they're doing is they're just going to expose us to a strain of the virus so that our bodies can build immunity. That doesn't mean that we're going to immediately become immune to the vaccine. It just means that we're going to have a greater chance at resisting. But the best way to avoid the spread of this COVID-19 vaccine is to continue to wear your mask and to continue to wash your hands and to practice social distancing until more information is available. Right? I got it?
Yes, you got it.
A+ on my exam. A++ on my exam. Let me see if there are any more questions. Okay. Did I mention commercial fishermen? Commercial fishermen, that's a very valid point. At what point in the phase process will they be introduced?
They would have to see where exactly they fit, because like I said, the phases, the outlines in the phases, they are quite clear. So if you don't fit in any of the first four, so if you're not over 60, if you're not of diverse ability, if you're not a healthcare worker, then you're not covered in one. Then, like I said, you have to see exactly where you fit. And if you don't fit in any of the first four, then it will be phase 5.
Okay, I'm just trying to scroll to find the exact phases.
The slide that we have here with the phases will need to be updated, because there is an update and it changes. It's not static, So when we started with the presentation, these were the phases, and as of today, there are like slight adjustments. So I think in the adjustment, I can actually send that with the log sheet, so you guys are familiar with the phases. But from what I can see here is that how do I go back? Can you take it back to the first phase? Yes. So here in phase 1, you notice that persons from the National Assembly is on this particular presentation, but with the updated phase, they are moved to phase 2. And the tourism industry, you're still in phase 2, but then even within the phases, there are tiers. So you'll be 2C. Okay. And then I think all the others in phase 3, can you take it to the next slide for me, Simone? Yes. In phase 3, all of those remained, and then there is a new insertion there that talks about person with core morbidities. And then we talk about the utility workers, and then phase 4 remains the same, and phase 5 remains the same.
Okay. All right, great. So that's excellent. Thank you so much for your participation today. Thank you for everyone who has actually tuned in to be a part of this session. It was a very informative session. A lot of the questions that were hovering in our minds, a lot of the fears we had about the vaccine as to whether or not we're going to die from it have been answered. And it's very good to know that the vaccine was selected by a panel of our respected peers. I saw a lot of our famous names in our medical field as a part of the review committee. So it has performed, there has been a review done locally, and our medical peers or our medical heads have approved the AstraZeneca vaccine on the basis of stability, meaning this is something that they can control the supply chain for, and efficacy, because it has been proven to work. Okay, I have one last question which says, homeowners who only visit a few weeks a year, will they qualify in any of the phases?
Remember, they can't mix the two vaccines. So you get here and have to get over there.
Okay, I'll have one of my colleagues. She can help me with that answer.
Okay.
Good afternoon.
Hi, good afternoon.
I am Dr. Pot. All right. With the vaccines, you have to remember that they cannot combine vaccines, right? For example, if they get AstraZeneca here, the second dose has to be AstraZeneca. You cannot combine AstraZeneca with a Pfizer or AstraZeneca with Moderna or any other vaccine. It has to be the same AstraZeneca. Like I said, I don't know if they told you, but a card is given with the vaccine, the name of the vaccine, so that if in case they want to put on a vaccine somewhere else, they can use that card.
Okay. All right, that's very good information, Dr. Potts. So once you participate in any type of vaccine or brand of vaccine, you have to continue your immunization and your booster process in that particular brand of vaccine.
Yes.
So Pfizer cannot be used with Putin, Sputnik, it cannot be used with Moderna, it cannot be used with AstraZeneca. So it has to be all the same.
Yes. Remember, if you get the first dose of AstraZeneca, it has to be, the second dose has to be AstraZeneca.
Okay. And then afterwards, because basically my understanding is that this will continue like a flu shot. So you'll have to take like boosters on a yearly basis. So is it after the first dose you can change, or you just have to stay with it the whole time?
Well, right now it's still under research, right? So we will be able to give you more information as we go along during the year, right? But so far, what we have known is yes, it will be like something like a booster, and we are not sure if you will be able to change maybe to Johnson & Johnson since it's one dose. All right.
Okay. All right. Is there anything else that you guys or that the team from the Ministry of Health would wish to add as their closing remarks to everybody who is still in attendance?
Well, we just encourage everyone to send in their information, encourage everyone to come and get their vaccine. As the phases roll out, we'll be trying to announce them so that you would know where we're at, so that you can come and get your vaccines.
Okay, excellent. So we actually had a very, very good session here today. Very engaged audience. I hope we were able to answer all of your questions here today. And the Ministry of Health, they have left their email address here. And the hotline number, was that provided?
I'm not sure.
Here We'll share that with the list for the log sheet because there are different numbers for different districts.
Okay, so as soon as the BHA receives a copy of the log sheet, we will be sending out to the members on our list. You and the emails that have been provided. If you have not already, or if you're not on our list, just quickly click the subscribe button, which is on the BelizeHotels.org page. And what we will also do is we will be sending out a copy to the hoteliers that are on the BTB list as well, because vaccination is important. The whole country has to become vaccine or immunized, sorry. So we just need to make sure that everybody has access to this information. And the office number is again 223-0669. You can always reach out to me between the hours of 8 and 5 p.m. And then I'll be able to help you. All right?
Okay. Thank you.
Okay, so thanks to everybody who is here. In upcoming announcements, we will be arranging an anti-trafficking session with let me just get the information. We will be having an anti-trafficking session later this month. This is a training session that is being organized by Michelle Segura and her team.